Welcome to the Pediatric Advanced Life Support chapter on pediatric pharmacology. We will look at some of the most important medicines used in pediatric advanced life support, along with their indications, some side effects to look out for, and the appropriate dosage that should be administered. Adenosine is indicated for supraventricular tachycardia. Side effects may include facial flushing, shortness of breath or difficulty of breathing, lightheadedness, nausea, low blood pressure, palpitations, chest pain, or headaches. The dosage is as follows. An initial dose of 0.1 milligrams per kilogram via IV or IO route, using a rapid push up to a maximum of 6 milligrams. The second dose should be 0.2 milligrams per kilogram via IV or IO route, using a rapid push up to a maximum of 12 milligrams. Albuterol is indicated for asthma, anaphylaxis, and hyperkalemia. Side effects are anxiety, headaches, coughing, difficulty breathing, palpitations, tachycardia, high or low blood pressure, heartburn, nausea, diarrhea, and reddening of the skin. The dosage of albuterol is as follows. 4 to 8 puffs to be repeated after 20 minutes as needed. For children under 44 pounds, 2.5 milligrams per dose every 20 minutes, and for children over 44 pounds, 5 milligrams per dose every 20 minutes. The drug Amiodarone is indicated for supraventricular tachycardia, ventricular tachycardia, and pulseless arrest. Side effects include headaches, dizziness, pulmonary fibrosis, acute respiratory distress syndrome, bradycardia, nausea, vomiting, rash, hyper or hypothyroidism, congestive heart failure, and abdominal pain. The dosage of amiodarone is as follows. For supraventricular tachycardia or ventricular tachycardia, administer 5 milligrams per kilogram IV or IO load over 20 to 60 minutes with a maximum dose of 300 milligrams. For pulseless arrest, administer 5 milligrams per kilogram via IV or IO bolus with a maximum dose of 300 milligrams. Atropine is a drug indicated for symptomatic bradycardia, toxins or overdose, and a rapid sequence intubation. Some side effects may be headache, dizziness, blurred vision, tachycardia, low blood pressure, nausea, vomiting, urinary retention, rash, and dry skin. The dosage for bradycardia is 0.02 milligrams per kilogram via IV or IO route, and this dose can be repeated once, or it may be administered via endotracheal method at a dose of 0.04 to 0.05 milligrams per kilogram. The dosage for toxins or overdose is 0.02 to 0.05 milligrams per kilogram via IV or IO route initially, to be repeated every 20 to 30 minutes for children under 12 years old. For children over 12 years old, administer 0.05 milligrams per kilogram via IV or IO route initially, and then 1 to 2 milligrams repeated every 20 to 30 minutes. For rapid sequence intubation, the dose is 0.01 or 0.02 milligrams per kilogram via IV or IO route, or 0.02 milligrams per kilogram via intramuscular route. This concludes our first video on pediatric pharmacology. Please proceed to the next video to learn more.